Good afternoon, ladies and gentlemen. Welcome to our new segment of Medcast, your new gateway to the latest medical updates and trends. Our segment today exploring the rapid advancement in medical imaging over the past decade. Radiology has seen a remarkable evolution from ultra-high resolution imaging technologies and faster scanning methods to the integration of artificial intelligence and big data. These innovations have revolutionized diagnostic accuracy, streamlined patient care, and opened doors to new, less invasive treatment options. Today, we will discuss how these breakthroughs are shaping the future of patient diagnosis and treatment with Dr. Mohammad AlSayegh. Welcome, Dr. Mohammed.
Well, thank you very much for having me here
We
again.
are we are so happy to have you again here. Dr. Mohammed, let's discuss how your field have improved in the last decades, which are, I think, there's a big improvement using your machines, and even the machines themselves have also big improvements. So, how imaging like X-rays, CT scans, or MRIs used to diagnose and guide treatments?
So back in the days, we didn't have MRI,
Mm-hmm.
right? So MRI started as a technology internationally within, let's say, the 80s. And then CT scanners used to work much slower. Each slice of the body used to be imaged separately.
Mm-hmm.
Now we use helical CT, which takes the whole image within less than 30 seconds.
Which is great.
Which is amazing
Yeah.
for both a patient and for acute care.
Mm-hmm.
And with radiology, like X-ray imaging, it's so much different because back in the days we used to have films, now it's digital.
Mm-hmm.
And with digital, you can modify the contrast of the image and
Yes.
you can correct for any extra radiation or less radiation or obese patients or pediatric patients like children.
Mm-hmm.
And then with ultrasounds, now we have huge differences in the quality of the image. The quality of the image now is much more diagnostic than it used to be because the ultrasound devices are connected to much better computers.
Mm-hmm.
And lastly, what we have as fluoroscopy, which is the video of the X-ray, is much less radiation exposure. Back in the days, we used to have a lot of both patient and physician harm.
No, that's very great. Now, it's surely now you are using these new technologies in the interventional radiology, which we discussed in the last episode about the spine pain management. And
Yes.
you have mentioned that that would give you like the precision to target the pain and in the exact place inside the body. Now, could you please tell us how important is the that precision is required in treating the pain?
Yes, so let's talk about two things, mainly in the lower back and in the upper back. We have two main sources of pain, be
Mm-hmm.
it joint or nerve.
Mm-hmm.
So if it's nerve pain, we are talking about very delicate structures. So the nerve itself and then the spinal cord. If you would not have correct or very high precision,
Mm-hmm.
you wouldn't reach the correct site to
Yes.
deliver your medication or your effective management, such as burning the nerve or burning the disc or changing the conduction of the nerve. Talking about the joints, what usually happens back in the days by surgery, we used to go to the facet joint, which is one of the main joints of the vertebral bodies, and cut the nerves around the joint
Mm-hmm.
so that the brain wouldn't feel any pain from the joint itself. Now we can actually target the nerve using a needle. And this cuts a lot of time and effort both for the patient and the physician.
And gives rapid recovery, as you have mentioned as well.
Very true.
Now, regarding these technologies or the improvement in the machines, that gives you more proud, let's say, proud spectrum of procedures you are doing to the patients, such as nerve block or even epidural injections. Now, could you please tell us about the different procedures you are doing to the patient and how could that differ from each other?
Yes, so procedures that are done in the spine are either transforaminal, which means near the nerve
Mm-hmm.
that is compressed by the disc, or epidural injections. These are usually steroid injections. Once we inject them, the inflammation around the nerve goes away. So there is no pain conducted, and we wait for the disc to heal by itself. It usually heals within about 7 months within for 90% of patients. So dulling the pain around the nerve for 7 months usually kills the pain, and then the disc shrinks by itself.
Yeah.
It's like a wound that heals, you know? Talking about facet joints, we do rhizotomy. Rhizotomy is uh, uh, burning the nerves around the joint of the back. So it is a very effective technique for osteoarthritis, both for the spine and the knees. So talking about neck pain, most of neck pain, if it's not caused by spasm, which is the main cause, the second most common cause is due to the facet joints. Once we burn the nerves around the joints, the pain goes away. And usually, if the patient corrects his lifestyle, the pain wouldn't come back again.
And do you have one? I think one of the procedures is called radio frequency ablation.
Yes,
Yeah.
radio frequency ablation is having a needle connected to a wire, connected to a conductor device. So a conductor device produces electricity and it goes through the wire and it gives off radio frequency waves. These radio frequency waves are only delivered to the tip of the needle. So all of the needle is covered by, let's say, a plastic cover, and only the tip of the needle is metallic. The tip of the needle heats up. We can actually control what heat we want to give off. So usually for a radio frequency ablation, we reach a temperature of about 80 for 1 minute and 15 seconds. Once we do that, doing an ablation kills the nerve for about 1 year to 3 years, depending on the condition of the patient.
Which keeps the patient away from the pain, actually.
Exactly. And then we send the patient to a rehab physical medicine, and they take care of strengthening the back muscles, and the pain won't come back again.
Oh, that's very great. Now, before comparing these to the surgeries and the medication use, are they safe procedures?
They are very safe with a very effective radiology imaging. So now we can actually see the facet joint very clearly, and we can target the nerves very precisely.
Okay, that's very great. And now, if we compare that to the surgeries and the medications, so how safer they are from the medications and the surgery?
Let's talk about medications first. Medications usually are non-steroidals or SSRIs, which are serotonin reuptake inhibitors, that usually modify the patient's response to pain. So they don't really take out the main cause. Once the patient is off their medication, the pain comes back. So if the patient does not do correct rehab, or the osteoarthritis or the nerve pain is very high, the pain signals in the brain will fire up. Having surgeries is a corrective for mechanical pain. So we're talking about a facet joint that is osteoarthritic, rubbing two bones against each other, fixing these joints with screws usually does not allow the joint to move and kills out the pain, but it makes the lower back or the neck less flexible,
Yes.
putting more strain on the other joints. So with time, usually the pain comes back at a higher or lower level. So you are in a rabbit hole. You're fixing one thing, and with time, the pain will come back at another level.
By running another thing.
Exactly.
Yeah.
So doing interventional radiology targets the site of pain and dulls out the pain, and then the patient has to do the work himself, which is a recovery rehab.
Okay, now if we consider your procedures as minimally invasive, as we call it in medicine, so how long would the patient take to recover from the procedure you have done?
Usually, 1 day is the injection recovery. So within 24 hours, in some literature, it's 48 hours. The patient can go back to his normal lifestyle. Patients have very different times of recovery with regards to pain. So usually we give a time frame of 3 days to 14 days, after which the patient can do everything.
And would you recommend like the patient would use some medications in line with the procedure you have done for him?
Very true for the beginning.
Mhm.
So just to bridge the gap of the 14 days, we usually recommend patients to take medication PRN.
Okay, Dr. Mohammed, we are so pleased to have you today, and the speech with you was very fruitful. Hopefully, we can meet you again in our program.
And thank you very much.
Thank you so much. Our dear viewers, we have reached to the end of our segment with Dr. Mohammad AlSayegh. Hopefully, we can meet you again with another medical specialist. Until that time, see you later.